pleased to have all stakeholders on the call, faculty, staff, students, and friends of the university. I want to start off today's session just in remembrance of two great leaders we just recently lost. The first, as you know, was Reverend C.T. Vivian, effectively the field marshal for Dr. King and the Civil Rights Movement. And the second one is Congressman John Lewis, a man I had the privilege of meeting just a few short years ago and actually moderating a panel for him for about 2,000 Delawareans. It's been a tough, interesting 2020 on a lot of fronts, but when you think about the people that we have lost, particularly these two giants, and what we are experiencing right now in our country, it makes Delaware State University more relevant in my view than it ever has been before. People talk a lot about passing the torch. You can see in these giants that we've lost that passing the torch is really real. We really don't have many of those leaders left from the Civil Rights Movement. They paved the way, many before them, for us here today, and it's our responsibility to continue to pay that forward. That's what makes me most proud about the university that we are all loving and learning from. To the students, I would remind you all that in the Civil Rights Movement, most of those folks were somewhere between 19 and 30. In fact, when Congressman Lewis gave his famous speech during the March on Washington, he was the youngest speaker of the day, and he was 23. So just think about that for a moment. Our responsibility, particularly our faculty and staff, to grow students who can become great leaders and not only be great at their chosen discipline, but also know what it means and why it's important to reach back up in very, very thoughtful ways. So I am proud of everything that's happening here today. And I am proud of the course we are on and what that means for this community. And today, what we're mostly interested in is walking you through another progression of getting to August. What's important today is student life. Student life in many ways is the bedrock of this institution as it relates to making sure that we can extend services that really create the Delaware State experience for each of our students. And while sometimes they get a lot of the pain, they also really create the setting for our students to learn and grow in. So today I'm pleased to have my colleagues, starting with Dr. Downing, who's the Vice President for Student Life, Jasmine Buxton on her team, who's the Associate Director, Philip Holmes, who is the Director of Housing and unfortunately a Steelers fan, Kiana Hutchins, who runs a lot of student government activities and student leader growth and development, does a wonderful job there as well. And of course, the amazing Dr. Michelle Fisher. I just want to make a comment about Dr. Fisher. I don't think we would be at this point without her leadership. She has been really a rock as it relates to the safety of our students and how, as we prepare for the reopening. And she is not afraid to push back. And I think that's made us better throughout this process. So Dr. Fisher, I just want to say a special thank you to you. This program will run much like it did last week, which is to say that the team will go over in detail what we believe you should be preparing for, particularly students and your families as we enter into the fall. And then hopefully we'll have a very, very robust Q&A period. So with that, I'll turn it over to Dr. Downing.
Good morning, everyone. So again, we're excited to present some great information for you all as we prepare for our fall opening. We have been working very, very hard and have many long hours to get ready to welcome you back into the fall semester. We're excited about the things that we're preparing, the information that we are going to share with you. So we hope that you pay attention and again, ask questions because we want you all to be prepared as you campus in September. Again, we're excited. We've done a lot of due diligence, making sure the things that we are putting into place, one, will ensure your safety, and secondly, that you have a great campus experience once you return with our new normal. So again, we'll get started. First, I want to, again, Dr. Allen said it best, have Dr. Fisher, who has been in the trenches from a health perspective, making sure that all that we are doing, that we're putting the health and safety of our university community at the top of the list. So she is going to share some great information for you to prepare for your return. So get out pencil and paper, take some great notes, and we'll begin with Dr. Fisher.
Good morning, everyone. I begin this presentation with a question. DSU Healthy Together, what does it mean? It means that health services, along with members of the COVID-19 task force, have worked countless hours planning and replanning how to safely reopen the campus. As I have made recommendations on how to safely reopen the campus, I have made them as a healthcare provider, a parent, a grandparent, and as an individual on this campus who falls into a vulnerable population category. Our goal is to maintain a healthy campus community as we assist students in maintaining their health and wellness. To achieve this goal, the Student Health Center will utilize telehealth screenings and visits by appointment only in an attempt to limit your potential exposure to COVID-19 and other illnesses. Although things will be managed differently, to promote a health and safe community, the Student Health Center team is still here to assist students with their healthcare needs. The staff can be reached by telephone at 302-857-6393 and by email at studenthealth2020@desu.edu. Next slide, please. In the next couple of slides, I will review the required and recommended health and safety guidelines. Requirements. All students must get tested 5 to 7 days prior to returning to campus and submit the test results to the Student Health Center to be cleared to come to campus. I am aware that there are some challenges in getting tests and test results in a timely manner. Therefore, I recommend that you plan accordingly. And to assist you, information will be posted on the university's COVID page with testing locations in your state. New students must submit a completed health form, and returning students are asked to update their health information in the Student Health Portal. Next slide. Students will also be required to complete a daily screening form prior to leaving their room. Wear face coverings in all common areas. Participate in assigned COVID-19 testing events. Cooperate with contact tracing and isolation and quarantine guidelines if they become necessary. And most importantly, because prevention is key and has been proven to reduce the spread of infection in communities, adhere to all CDC infection control guidelines, such as physical distancing, good hand hygiene, wearing face coverings correctly, and by correctly, I mean that it must cover your nose and mouth, wiping down frequently touched surfaces, and staying home when sick and seeking medical care. Additional preventive measures is to make sure that you get plenty of rest, that you're eating a balanced and healthy meal, that you're drinking fluids, at least 64 ounces of water and non-sugary beverages, and if you take a daily prescribed medication, that you take it. Next slide. The following is strongly recommended. If you fall into a high-risk category due to having a chronic medical condition or a compromised immune system, it is recommended that you stay home and take classes online to limit the potential exposure to COVID-19. That all students get the flu vaccine prior to returning to campus in August, and that if you're taking the university's health insurance plan, that you enroll early, starting August 1st, so that you can take advantage of those benefits, which does include medical and mental telehealth benefits, 24 hours, 7 days a week. Next slide, please. The following is recommended, that you bring these items to campus with you. Prescription medications that are taken or used regularly, such as allergy medications, inhalers, eye drops, birth control, and also know that most pharmacies dispense 3 months supplies of medications, depending upon your insurance. So you want to check with your local pharmacy and your insurance company to make sure that you can get at least a 3-month supply. Some will dispense 6-month supplies. And it's also important to make sure that you have a local pharmacy in the Dover area and prescriptions that have refills on them. Again, we are going to be here to assist students, but we don't want you to have interruptions in your healthcare because we are working differently in our new normal. Next slide. Additional items to bring to campus are items that we have frequently realized that students typically come to the health center for. And that includes any durable medical equipment such as a nebulizer for asthma, basic first aid supplies such as Band-Aids, ice packs that do not need to be refrigerated, over-the-counter medications such as Tylenol, ibuprofen, and cough medication, several face coverings that can be washed frequently, and hand sanitizer. Next slide, please. So I am going to close as I've opened. DSU Healthy Together. What does it mean? It means that what we do affects you, and we have and will continue to do our part to promote a safe and healthy campus community. Can I guarantee that you will not get COVID? Unfortunately, I can't. And realistically, I cannot guarantee that I will not get COVID. But what I can assure you, as I've previously stated, measures have been put in place to promote a safe and healthy campus community. What you do affects us. And as a member of this community, it is your responsibility to adhere to CDC infection control guidelines and all safety rules and regulations which will be posted throughout campus. I look forward to partnering with you as we work together to keep our campus community safe during this pandemic. Thank you.
So thank you, Dr. Fisher. Just a couple things that we want to emphasize during her presentation. Again, it's going to be so critical for you to make sure that you bring all the necessary things that you need and to bring a mask for face coverings. As we talked about, as we move forward, there is going to be a different feel to campus, but once we work together with you, wearing your mask, washing your hands, practicing great hygiene, we know that we'll have things in place to get us over this hump with COVID-19. So again, be mindful of the things that you need. Be prepared when you come. Again, face coverings will be your best bet, your best friend, the best thing since, you know, the invention of bread. So again, be mindful of all the things that she said on this list because it's going to be impactful as we have accountability to each other. So again, thank you, Dr. Fisher, for that information. As she stated, as well, it will be posted on the COVID, on our DSU website, on the COVID-19 webpage. So now we'll go to, again, the great Mr. Philip Holmes. Many of you have been wanting to hear information. He's going to deliver. He's going to come through with some great information. You haven't seen his face. He's been doing a lot of emails. So now he's in the spotlight. So Philip, you're on.
All right. Good morning, everyone. I'm sure many of you are trying to get back to some semblance of normal. And want to come back to campus, and we want that for you. So we do just want you to know some information before you do so. All right, so based on the university plan for campus occupancy, we're going to be housing approximately 75% of students that we normally do on our campus. We would utilize all but one facility for living space. Assignments will begin starting this week. So if you've been selected to live on campus, you will receive the assignment information in your DSU email account. So please pay close attention to your DSU email, as this will be how we communicate with you, not only now, but all the time as you're a DSU student. So we'll watch your DSU email. Next slide. University Village apartments, University Courtyard apartments, and Tubman Laws will be fully occupied. Now, many of the students in these facilities will have their own bedroom or family unit space, and thus these facilities will be used at their full capacity. The Living Learning Commons, Winder Towers, Evers, and Jenkins Hall will house half of their normal occupancy, with many of the rooms being singles. Next slide. After assigning priority students on campus, any remaining spaces will be filled using a first come, first served method based on the date and time your application was submitted until the occupancy limit is reached. Okay, so all applications have a timestamp, and we will utilize this to house students in order to be most fair. With that said, Warren Franklin will be the one building we don't use for living space, but more so for isolation space, in case that is needed. Next slide. Now, I'm sure, since I said that a lot of people that applied to Warren Franklin have some instant questions about what if I applied to Warren Franklin. So freshmen who applied to Warren Franklin and are selected to come to campus will be housed in other areas using first come, first served methods like I explained before. So if you applied early to Warren Franklin, we will utilize your date and time that you applied. And if you were first, we'll just give you another assignment in another building. Okay, so move-in information will be emailed with your specific date and time frame to arrive on campus. Now, please try to adhere to your date and time frame as much as possible. Any changes needed, please email your facilities resident director to make any changes, much like we did during the move-out process. Speaking of which, move-ins will start the week of August 17th. I know that's a big question for many of you. So the week of August 17th, one of those days, you'll get an email telling you when to come to campus. And that will go on until Saturday, August 22nd. Now, within this time frame, we'll be able to complete all of our move-ins safely and effectively. And of course, our classes will be starting on August 25th. So we have to achieve that prior to then. Next slide. And when you get your email, many of the same instructions for move out are going to be used. Masks worn, limited guests, health forms, no moving bins, touchless move-ins, with Dropbox for paperwork. So you'll already be used to how the process works. So that'll be a good thing, that a lot of the same instructions you got for move out will be utilized for move in. So you should know exactly what to do. Now, please adhere to the move in instructions that you get in your email and help us to keep everyone safe. Now, I commend our students for following the rules for move outs and making things run efficiently. I look forward to a safe and smooth move-in process. Now, if you have any questions or concerns, please email us at housing@desu.edu, or go ahead and give us a call at 302-857-6326. And lastly, I want to commend the DHRE staff who've been here from the outset of this situation here. I want to call it a situation. They've been on campus this whole time, so I definitely want to commend them and all that they do for this university. Thank you.
Mr. Holmes, could you please give that contact information again?
Sure. It's to email us, it's housing@desu.edu, or give us a call at 302-857-6326. and we'll get the answers you need.
Again, thanks. And two, I would like to just really give kudos to the housing team who have been here since day one when we decided to move students off or have students not to return to campus. They've been here doing a lot of great work, and we do still have a lot of good work ahead of us as we do begin the move-in process. Again, I know many of you will have a lot of questions about move-in. As you know, the process before with the move-out, you can feel free to contact housing. They have been very responsive in getting you the information that you need. Again, be patient with us as we do go through this process. Many of you want to know when you will be assigned, where you will be assigned. Again, at 75% occupancy, we're going to do our due diligence to make sure we house as many students as we can safely. So again, as he did mention, assignments will start this week. So please pay attention to your email. Get ready to move back to campus and the things that we're asking you to do in that process. So again, thank you, Mr. Holmes. Up next, we have the dynamic Kiana Hutchins, who will make our campus experience great for your return. She's going to talk about some of the things that are happening in her area with student organizations, a couple expectations, what to expect in the fall regarding co-curricular involvement. So Ms. Kiana, you're up.
All right, thank you, Dr. Downey. So I know that there are some questions out there, of course, that students have about what student activities and events are going to look like. So I'm here to provide those answers for you today. In alignment with current state of Delaware orders, all student organization activities have been modified for the fall semester, right? However, changes are inevitable as the semester progresses, and I am optimistic that these changes will be for the better. All right, so I first want to go over some operations and procedures as it pertains to student organization meetings. So first point, these meetings should be held only if 6 feet of physical distancing can be achieved. An option for virtual participation for those members who are not comfortable is highly recommended. Number 2, an attendance sheet of all who attend a face-to-face in-person meeting or event should be kept. All right, so it's very important that if there's any meeting that happens face-to-face, that the organization take full accountability for keeping an attendance sheet. All right, this attendance sheet does not have to be submitted to OSLA, but it should be available in the event that there is a need to conduct contact tracing. All in-person attendees must wear face coverings. Room capacity reductions will restrict the number of members who can be in a space for face-to-face meetings. Groups should consider hosting meetings virtually. All right, I can't stress this enough. That virtual is the way to go. So please consider hosting meetings virtually, and also in smaller groups, if possible, in spaces that allow for physical distancing. Groups should also make sure that members know that if they are sick, they should not attend any face-to-face activities, events, or meetings. Next slide, please. All right, student organization activities involving guests. So we know that with a lot of our activities that occur on campus, guests maybe from other universities or guest lecturers or speakers, individuals come to our campus frequently. So to address this, point 1, these events should be conducted with the state of Delaware's, the universities, and any other pertinent agencies' guidance and regulation of events at the forefront of planning. So please, please, please refer to the state of Delaware, CDCs, the universities, the guidance that they have out there, the orders. Please make sure that you put those at your forefront of planning in the event that there are activities that you would like to host in which guests are involved. Due to capacity limitations and physical distancing requirements, these events may not be able to occur on campus. All right. So it's important that you keep that in mind as well. However, the OSLA office, campus events team, we will work together to do our best to work with all of our student orgs to make the events happen. But it's important that you be mindful that because of the requirements and the restrictions and limitations that are in place, there is a possibility that they may not be able to occur on campus. Next slide, please. All right, major events. These include parties, showcases, competitions, right? So these types of events, but of course not limited to these types of events. So point one, in compliance with physical distancing requirements and also in recognition of capacity limitations, these events are suspended for fall 2020, all right? I wanna go back to what I said at the beginning, that changes are inevitable, all right? And it is my hope that as the semester progresses, that everything will change for the better and that these procedures that we have in place now will hopefully be lifted and there'll be some flexibility with this. But as of now, based on the current state of Delaware and CDC guidelines, these events are suspended for fall 2020, all right? Point two, events that encourage attendees to gather closely together or touch shared objects, such as inflatables, carnival rides, and games are also suspended for the fall semester. And then last but not least, large events for which physical distancing is achievable may be considered. All right, these events should be held outside and in a space that encourages and permits physical distancing of 6 feet or more. All right, when outside space is not compatible with the event, indoor space limitations regarding maximum capacity and the ability to physically distance must be followed. Next slide, please. All right, so ending on a high note, hopefully, there will still be activities for the fall semester, okay? Again, as I stated earlier, I am highly encouraging all of our student organizations to think creatively and to devise ways to host a lot of your meetings and activities virtually for the fall semester. All right, I first want to begin by highlighting our Campus Activities Board, also known as CAB. I want to highlight a few activities that they have in place, much of which will be held virtually, but just to give you an idea of what the board intends to bring to you for the fall semester, we begin with I Love DSU Week, which is September 23rd through the 29th. All right, our Campus Activities Board is putting together a great week for DSU students, which hopefully will involve a combination of maybe some on-campus face-to-face activity along with virtual, but it will be mostly virtual, outdoor movies, novelties, as well as a monthly programming series. All right. Next up, our Student Government Association. Shout out to the Integrity Administration. They have, will roll out, I should say, Tell It All Tuesdays, which is a monthly series that they'll have for the student body. They will also be presenting leadership series in the fall semester, especially tailored to any students out there who may be interested in applying for a student leadership role in the spring semester. Also, they are working on an HBCU day for everyone and also the freshman election. That's going to be a really exciting time for the class of 2024 as they begin, right, their journey at DSU. So the freshman election, we've been working on that. It's underway. It's going to happen. All right. And lastly, as far as the OSLA office, we will be hosting Student Leadership Institutes in collaboration with the Office of Student Success in the fall. Also, the National Society of Leadership and Success, the NSLS induction will happen in the fall. We'll also have Greek Talks All right. We'll also have Greek 101, and also putting together a virtual student organization fair for all of our student organizations to highlight the great things that you do, and to also make sure that our student organizations are placed in a position to recruit new members and to still be highly visible on campus. So we're putting together that virtual fair for our student orgs as well. So all of that is forthcoming. Again, I want to stress before I end that organizations are encouraged to plan for the fall semester. Plan your meetings, plan your activities, but think about how you can do so virtually, all right? It can work. You just have to be creative, all right? So still put planning for the fall semester at the forefront of what you're currently doing as your boards are having conversations and you're also talking with your advisors. Make sure that you're planning for the fall, all right? I will continue to work with the campus events team regarding scheduling, and I will keep student orgs updated as more information becomes available. Thank you.
So again, thank you, Kiana. She gave a just a glimpse of what we will be preparing for in the fall. And of course, there's many different offices within student affairs that are going to also be planning activities. Again, our goal is to make sure that once you're here on campus that you will be engaged with different activities, making sure that we keep you connected to various events on campus. Again, we're encouraging things to be virtually. We're also going to work to make sure that we can have some face-to-face activities because we know that is important as well. So again, as student activities plan, as they are planning events and programs for you, just know that we have other offices, Spiritual Life, Career Services, the WRC. So housing will be doing programming within their facilities. So again, our goal is to keep campus as vibrant as possible, making sure that, again, that you have a great experience. Again, as she encouraged, as students, you all have the ability to be creative and come up with things. We're open to suggestions of what you think would be something that would be what we could bring to campus. So please not limit what you do to just your organization. Be mindful that what you can do can bring a big impact to campus. But again, start planning, have those programs, have those meetings, and again, work with the Office of OSLA for those types of events. And again, look for other information from other offices within student affairs, because again, our goal is to make sure that we do keep you connected. So thank you for that, Kiana, Miss Kiana. So now we'll turn it over to Miss Jasmine Buxton, who's the Associate Vice President for Student Affairs.
I didn't get like a good intro, but that's okay. Hi, everybody's been talking a lot. So my name is Jasmine Buxton, Associate Vice President for Student Affairs. Good morning, students and other people who are on the call today. We are excited and ready to bring you back to campus. This has been probably the longest spring break in history. And so we are ready to welcome new people. We're ready to welcome returning students. We have been working, as you can hear from our colleagues, we've been working diligently to make sure we provide the most optimal experience possible while keeping you as healthy and safe as we can. Just a little bit of some housekeeping notes, right? Some expectations that we have for our on-campus community is that the student conduct standards that we had before you left, they remain the same. We are obviously going to make some tweaks and adjustments as it relates to and making sure that we adhere to social distancing and mask guidelines, as well as making sure we're keeping students as accountable as possible as we navigate this new hybrid learning expectation. So we want to make sure that students are responsible for themselves, accountable to themselves as we facilitate and figure out what this new normal is. And although it's a new normal, it also is quite dynamic. And by dynamic, meaning it's ever changing, right? So something that could be a thing on Monday may not necessarily be the same on Friday. So we're just asking everyone, students, faculty, staff, but students especially, just to work with us. We've been trying really hard to make sure that we do everything that you would normally expect, but just a little bit more as it relates to health and safety. When you come to campus, those who will be invited to attend in the fall on campus in person, We expect you to exercise compassion. So thinking about others. I received a text message from a former Mr. DSU a couple of days ago, Raphael Jason Morgan, and he said, like, I hope you're living in happiness. And I'm like, I am happy. And so I appreciate people reaching out and making sure that as a staff, we're doing the right things, but then making sure that students, that you're compassionate and sharing things with others and checking on your friends and your neighbors. We want you to ask questions. I've been at Del State for almost 5 years now, and I've never had a student not ask me something, never question what it is that we're doing, and always holding us accountable. But also understand within those questions, we may not always have the answers. If you watch the news, it can change week to week. And so we're going to stay as updated and as much information, we'll keep that information as abreast as possible. And so we can deliver the optimal service, the responses that you need, but to show a little bit of grace as we try to navigate this thing together. Obviously, as always, we want to prioritize safety. We encourage you to engage in risk-averse behaviors, be respectful and considerate of others, and just adhere to this established and dynamic guidelines. But we want you to be engaged. It's like Ms. Kiana said, we're really trying to plan some good programs. SGA, Tess, and her team are really working hard to really try to develop something that, even though the year may not look the way we thought it was going to look, it's still going to be fun. We require and we need all of you to be just as engaged as you would be any other time, and making sure you keep your Wi-Fi connections together and all those things, and making sure you can really participate in some of those virtual offerings that we have. So if you have any questions about anything, if it's some positive feedback, please feel free to send it to me directly. If it's negative, you can send it to Dr. Downey. She's willing to answer those questions for you. But no, we all have individual email addresses, making sure that you just kind of come by our office with your mask on. We want to love on you and hug on you from a distance, of course, but the love is still there, and our commitment to serving you is still there. So we look forward to seeing you next month. And so with that, I'll send it back to Dr. Downing so we can start the Q&A.
This time, if Dr. Allen had some remarks before we go into the Q&A. Do I see him? Yes, Dr. Allen.
Dr. Downing, can you see me?
Yes.
Oh, yes. First, wonderful presentations by all. So thank you all for being so thorough and so committed to the student experience here at Delaware State. I know the students in particular heard some things that will be difficult to navigate. Know that we're in this together. That's what it's all about. So we'll get through it. And as Ms. Kiana noted, as the situation changes, we will adapt to it. Right now, it's about protecting each other, being thoughtful about that, and setting a standard so that we can have a great fall semester and prepare for an even greater spring. I do want to highlight a few more things too. One, I know it's been said, but I want to say it very clearly here. Wearing masks will be mandatory on the university's campus. It's very important, whether you're a faculty, staff, or a student, or a visitor, it's important that you are wearing masks at the university. You do know that we'll have a robust testing protocol. That will be very important. That is also for your safety. You heard that we have one dorm dedicated to quarantine for those who may actually be diagnosed as positive, also for your safety. And the online, the environment as it relates to instruction will be largely hybrid and virtual. I know many people had questions about that last week. Let me just remind you that we are able to provide about 85% of our courses in a virtual format. So course times, regular course times, opportunities for instructors to be engaged with students, but in that virtual platform. That gives us a unique opportunity, again, to engage you all while maintaining the academic continuity for your matriculation, and to be thoughtful about that as we move forward. So with that, I do want to open it up for Q&A for the team, but again, want to thank each of them. Jasmine, I don't have a wonderful introduction for you, but I think you took care of that for yourself. So I'm sure you'll continue that throughout the Q&A. Brother Darrow, any questions?
Yes, we have. Dr. Downing, would you like to move forward with it? Or?
Yes, so just a couple of things. A question that we did get in is the CAF and eating. So we have been working with our Airmark partners and trust and believe they are doing some great things to make sure, again, they can provide you with the service that you need. They're working with capacity, making sure that we have that we're following capacity codes. They're rearranging the dining facilities to make sure, again, that you can be in that space. They're providing different options as dine-in versus takeout. That will be your preference. So again, as they are putting their plans in place, they'll be wearing face masks. They'll be having sanitizing stations throughout the cafeteria, well, those facilities. Again, seating, signage, they are putting in place their protocols. And as they roll out that plan, we'll make sure that you all are in the know about that. And that will also be with our retail spaces like Grill Works, Subway, Chick-fil-A. Again, they're minimizing the risk as much as possible. They will have reduced hours, as most of our facilities on campus will have reduced hours. So please look for more information from Airmark, but they're really being collaborative, following some of the guidelines we have established on campus to make sure that you all are getting what you need. So a question, Mr. Holmes, will the assignment process not only begin, but will it end this week? So students who are assigned, who get an assignment, will that be completed this week or will it roll into next week?
I am not going to make promises. We're starting almost immediately this week. I hope to get all assignments by the end of the week, but if it goes into the beginning of next week, I won't be too upset. So just bear with us, be patient. We want to get them out as soon as possible, but there's a lot that goes into it to make this happen. So just be a little patient with us right now.
Great. So Dr. Fisher, with test results at times taking more than 14 days, how strict will the school be if we do plan ahead and get the tests take longer than 7 days? Or the test results are more than 7 days old?
Dr. Downey, let me start, and then I know Dr. Fisher will add. We actually started testing 2 weeks ago, so we did a little pilot with about 48 members of the university community. Those tests returned back in less than 30 hours. So we are very thoughtful and conscious of the reliability of those tests, which we know to be strong, as well as the time to return the results. We expect that to be our ongoing expectation, so that once you test, you will get those results quickly, and we can take the necessary precautions if that's needed. But I'll have Dr. Fisher add if I've missed anything.
You're on mute, Dr. Fisher.
Sorry about that. Actually, Dr. Allen, though, you did not miss anything in answering that question, and I have nothing to add.
Okay.
So we've received many questions on priorities. So at this time, we have been working very close with priority assignments. We have been working very closely with academic affairs and some other offices on campus to ensure that students who are either graduating, have internships, have clinicals, student athletes that need to be on campus receive priority housing. We are confident that once those spaces are filled, we'll still have a significant amount of assignments or spaces to put students in. Mr. Holmes did a fantastic job of explaining the assignment process. It's the same that it has been previously. After we do assign those priority students. So again, with the assignment process, we have many more questions with that. Can you go over that process one more time, Mr. Holmes, on what that means?
Yes, much like Dr. Downing said, normally we use a first come, first serve process. We utilize the timestamp that when you actually applied to do so. I think that is the most fair way to do things. Once we assign the priority students, we will go to that method to fill the rest of the spaces that we have for our occupancy plan.
So question, I am a commuter student. All these policies discussed will occur while students are on campus. Are there any specific policies for individuals who commute and live at home? Again, great question. I think, again, we talked about prior to you coming to campus, whether you're leaving your room or driving onto campus for an in-face class, we do ask that you fill out the screening form that will be required of every individual who comes to campus each day. Again, if you're participating in a program on campus or a virtual program, online classes, in-person classes, again, the policies that we've established that will be placed, if they're not already on our COVID page, we're asking you all to adhere to those guidelines and recommendations. So do you have anything to add to that, Dr. Allen?
No, I think you covered it. Thank you, Dr. Allen.
Student health forms. So Dr. Fisher, there's a question, where can they find the student health forms and where is the student health portal located?
The student health forms are posted on the DSU website under Student Health Center. I apologize, I don't have the portal information, but I will send a text message right now to my team and ask that question.
Thank you. So, Mr. Holmes, what will happen for housing if we stay home in the fall and want to return back in the spring?
Yes, we're getting a lot of emails with students asking that very question. Can my position be held until spring? Presently, we cannot guarantee that the exact same room will be yours. But what we can do is work closely with you in order to try to get you a space similar to it or exactly like it. Right now, again, we're trying to move through our priority list and housing as many students as possible. At the end of this semester, we will move on to the next and work with students to try to put them back in either the same place or something similar. Okay, so just work with us on that.
Dr. Downey, I just want to add, because I know there's been a lot of concern about the 75% occupancy. One, that is for everybody's safety, obviously. And while it doesn't guarantee housing at our normal occupancy rate, we are thinking through other housing options, but those also have to be safe and in our guidelines. I can tell you one thing, they won't be hotels. And we haven't made a decision as to how we are moving forward there, but we are thinking about that additional 25%. And if we're able to accommodate it in a right way, thoughtfully, and under our similar guidelines, we will do that.
Great. Will we have to stay home after the Thanksgiving break?
So the answer to that is yes. So the normal start will occur next month. And then what will happen is you will break for Thanksgiving and take your classes virtually in the December timeframe. Again, that is another point of protection. There are very few schools I know in the country that aren't following that similar guideline. Effectively, what we're trying to do is get ahead of the flu season on the front end and give ourselves enough time to assess the situation before return in the spring.
Thank you. Will the Wellness and Rec Center be open? Our facilities will be open during the fall. We will have different hours and we are working through a plan of what that looks like. I know the team in the WRC is working to rearrange the space to make sure you could come in, be socially distanced, work out, stay healthy. So yes, the Wellness Center will be open, the Student Center will be open, the library will be open, but again, we are going to be working on different hours of operation. I like the background picture at Tony Allen's office. It's nice. So kudos to your picture in the background picture.
Yeah, Dr. Downey, I was on a meeting with her last week and she had Prince in the background, which was odd. But thank you. I try to be culturally relevant. Thank you.
Will disposable masks be provided or available for students? Dr. Fisher?
We are working now to get disposable masks so that they will be available. I still have to encourage everyone to bring their masks. As you are aware, there is a nationwide shortage of masks, but we're doing our best to have them available for students. And if I could just answer the portal question, it is on the Student Health webpage at the bottom. There's a link that will connect students to the portal.
Okay, thank you. So we are getting a lot of questions about academic online hybrid. Can
Sure.
you, Dr. Allen, let them know
Sure.
that will take place?
Yeah, Dr. Downey, thank you for that. And I won't try to belabor it here because I know that's an important question as it relates to academic continuity for the students. On Thursday, this Thursday, we will have another session focused specifically on fall instruction. So we'll take a very deep dive on what hybrid means in this environment. What the expectations will be, both on the student side and the faculty side, and then make sure that we can answer all your questions then.
Great. So again, we do have a testing question. Will testing occur once we get to campus? Dr. Fisher?
Dr. Fisher, you want to go first?
Yes.
Okay.
As has been previously stated, students will be required to get tested prior to coming to campus. And then, yes, they will be tested again once they come on campus. This is being done to do our due diligence in keeping our community safe. We don't want to have to bring students into the community and quarantine them the first week that they're here. And so that's why we're requiring testing before and then testing once students arrive on campus.
Dr. Allen, did you want to add something?
Only that, and this might be for parents if they're asking about it. It is a full protocol. So as Dr. Fisher noted, there is a before practice and on-site practice once you arrive. But then throughout the semester, there will be a random sampling of protocol based on various risk factors we determine. That helps us always think through our other folks being diagnosed and what we believe the volume is on campus. It'll give us an opportunity to adjust up or down accordingly, like Ms. Kiana was talking about. So it's very important that you embrace that process. The only other thing I'll say is the Testing for America group that we have on board helping us through this process has continued to emphasize the notion that we all have to be sort of stakeholders in our own progress here. So you'll see that the Department of Public Health, run by Dr. Mason, obviously Dr. Fisher, the Student Government Association and other student groups will be very, very helpful, both in showing leadership on the score and promoting the safe environment that we all are hoping for.
So we have several questions regarding once I'm on campus living, can I come and go? So again, I think we've established that once you're on campus, again, our expectation is that you be mindful as you move around, whether you're on campus or off campus, and be safe. Again, what you do can impact others. So if you decide to leave for the weekend, please be mindful of what you do when you're not on campus. Wear your mask, wash your hands. Again, it's going to be critically important that you follow all guidelines. And when you return to campus, we are in conversation about what does that look like for you. Will we test you once you get back if you told us you're going away from the weekend? Again, we're putting all those protocols and process in place. But what I would like to just emphasize again, be mindful of your behavior, where you're going, what you're doing when you're in those spaces, because again, it's not a lockdown. You can come and go as you please. Again, you're living on our campus. You might work in the community. Again, you might have clinicals, labs, and things of that nature. So no, we're not going to dictate your comings and goings, but what we will always encourage is the behavior once you're out and about. And what does that look like? So again, just being mindful of that. And again, what you do outside or could impact your roommates, your faculty members, staff, that sort of thing. So again, no, we will not monitor or dictate what you can do, but we probably are working to put some protocols and processes in place for that, for those such things when you do want to travel. So if a roommate would get COVID and would have to go to Warren Franklin, will we have to be isolated since we are with them?
That is a very good question. And yes, the CDC does recommend that contacts, and especially close contacts, are placed in quarantine. So if someone's roommate tests positive, they will be put in quarantine for 14 days. And again, that's to ensure your safety and also the safety of others in the community.
So again, the other questions are very specific. Again, it's going, I'm pretty sure, Mr. Holmes, your email is quite full at this time. Again, students just have specific questions about who they want a roommate, who they would like to have as their roommate, when they're going to get the email. But again, I think we've covered general questions. Again, Dr. Fisher told you where the health forms can be found to upload those health forms. Any information regarding COVID, the testing will be placed on our website. Again, if you have questions for Ms. Kiana, Ms. Buxton, Dr. Fisher, or Mr. Holmes, you all know how to contact them. Again, this is an ongoing process. We are always going to encourage you to check your email, as that will be a way we will communicate. Again, students, we are asking you to put your creative caps on for those who will be living on campus. Again, our goal is to make sure you have a great experience, and we need you to be collaborative to make that happen. Dr. Allen?
First of all, thank you, Dr. Downing. Thank you, team. I think you did a tremendous job. I hope everybody appreciates the deep dive we're taking into all of these topics as we go toward the fall. I can say that I've been in several interviews over the past couple of weeks about our fall reopening plan, and one of the questions is related to why you're bringing your students back. And I can tell you that and if you don't know, you should also know, particularly as students, there are disproportionate realities as it relates to Black and Brown people and health disparities writ large. COVID is no exception. So our ability to want you back in a safe space that I know you already call home is important to us. We believe our brand of education is the kind of education that you need. We don't want any interruption in your academic continuity. We want you to graduate on time. And in order for us to do that, we have to do it together. So I do believe that this has been very, very important deliberating decisions for us, but we've come on the right side of this. Now it's time for execution. And the execution part is really about all of us. It's not what we are simply able to do for you, but what we're all able to do for each other. So thank you. This Thursday, remember, is specifically on instruction for the fall. It'll be led by your provost, Dr. Sandra DeLauder, and her team, and it'll be a deep dive similar to this. And then next week, we'll have 2 other sessions, another Tuesday, Thursday combination that takes a deep dive with respect to faculty, staff, and employees. So thank you for all you're doing. Thank you for what you will do. And remember, folks like Congressman Lewis and Reverend Vivian, what they did so we could have this very opportunity right here today. Let's take full advantage. Have a great day.